Hi, I'm Dr. Ratna. I'm the CEO of an organization called DakshamA Health, which is a patient advocacy organization based out of India. And I also sit on the board of the International Alliance of Patient Organizations. I think the three key words that were used was trust. So building trust in AI and how can AI talk more to patients so that they are able to understand what benefits AI can bring to them and how they can improve the access to healthcare. The second was collaboration. How can more stakeholders work together to make AI truly inclusive so that all stakeholders' voices are included? And the third was having a robust regulatory mechanism so that the ethical part of it is maintained and that there are boundaries that are preserved. As I said before, not enough inputs are being taken from consumers or patients or caregivers. Since healthcare is very diverse, a lot of data has to come from the field, from people who are actually experiencing the healthcare condition and are able to input in a real world status. And my experience of having a heart attack, for example, in a city is different from a person having a heart attack in a village. So having that real world experience to build into AI algorithms would be very important. And therefore, the patients and caregivers and the entire ecosystem as a community needs to understand the benefits of AI, and the capacities of these people who input their experience needs to be built.
Thank you.
Thank you.